Jaundice is a condition characterized by the yellowing of the skin, mucous membranes, and the whites of the eyes, sclera, caused by an accumulation of bilirubin in the blood. Bilirubin is a yellow pigment that is a byproduct of the breakdown of red blood cells. Jaundice is not a disease in itself, but rather a symptom of an underlying condition that disrupts the normal metabolism of bilirubin. It can affect individuals of all ages, from newborns to adults, and may be associated with a wide range of disorders affecting the liver, bile ducts, and red blood cells. Causes of jaundice. The cause of jaundice can typically be categorized based on where the problem occurs in the body's bilirubin processing system. 1. Prehepatic. Before the liver, this type of jaundice is caused by an excessive breakdown of red blood cells, leading to an increased production of bilirubin. Conditions associated with prehepatic jaundice include hemolytic anemia, conditions like sickle cell disease, thalassemia, or autoimmune hemolytic anemia, where the red blood cells break down prematurely. Transfusion reactions. When a person receives an incompatible blood transfusion, it can lead to the destruction of red blood cells. 2. Hepatic. Within the liver, in this type of jaundice, the liver itself is unable to properly process bilirubin. The causes include hepatitis, inflammation of the liver, often caused by viral infections, hepatitis A, B, C, alcohol use, or certain medications. Cirrhosis, scarring of the liver due to chronic liver diseases, often caused by alcoholism, viral infections, or non-alcoholic fatty liver disease. Liver cancer, tumors in the liver, can impair its ability to process bilirubin. Post-hepatic, after the liver, in this case, the liver processes bilirubin, but the bile ducts that carry it to the intestines are obstructed, leading to jaundice. Conditions causing post-hepatic jaundice include gallstones, hardened deposits of bile in the gallbladder or bile ducts that block the flow of bile. Pancreatic cancer, tumors in the pancreas can obstruct the bile duct, causing a backup of bilirubin. Cholangitis, inflammation of the bile ducts often caused by infections. Pathophysiology of jaundice. Bilirubin is produced when hemoglobin from old or damaged red blood cells is broken down in the spleen. It is then transported to the liver, where it is conjugated, made water-soluble, and excreted in bile. Bile is stored in the gallbladder and later released into the intestines to aid in the digestion of fats. Unconjugated, indirect, bilirubin. This form of bilirubin is not water-soluble and is transported to the liver bound to albumin. Conjugated, direct, bilirubin. This bilirubin is processed in the liver and made water-soluble. It can then be excreted through the bile into the intestines and eventually excreted in the stool. Jaundice occurs when there is an imbalance in any of the stages of bilirubin metabolism. If too much bilirubin is produced, as in hemolytic anemia, the liver cannot process it fast enough, leading to its accumulation in the blood. Alternatively, if the liver is damaged or the bile ducts are obstructed, bilirubin may not be excreted properly, also resulting in jaundice. Symptoms of jaundice. The primary visible symptom of jaundice is the yellowing of the skin and eyes. However, there are other associated symptoms depending on the underlying cause of jaundice. Fatigue and weakness. Many underlying conditions that cause jaundice can also result in generalized fatigue. Dark urine. Due to the excess bilirubin being excreted in the urine, it may appear darker than usual, dark amber or brown. Pale stools. A reduction in bile reaching the intestines can lead to pale or clay-colored stools. Itching. Pruritus. This is common in obstructive jaundice, where bile salts accumulate in the skin. Abdominal pain, particularly in cases involving liver disease, gallstones, or pancreatitis. Abdominal pain may occur, often in the upper right quadrant. Nausea and vomiting, often associated with liver and gallbladder diseases. Fever. In infections like hepatitis or cholangitis, fever may be present. Diagnosis of jaundice. To determine the cause of jaundice, healthcare providers use a combination of clinical evaluation, medical history, and laboratory tests. The following are important diagnostic steps. 1. Physical examination. The doctor will look for signs of jaundice in the skin, sclera, and other areas of the body. They may also palpate the abdomen to check for liver enlargement or tenderness. 2. Blood tests. Liver function tests, LFTs. These tests measure the levels of various liver enzymes, such as AST, ALT, alkaline phosphatase, and bilirubin. High levels of unconjugated bilirubin may indicate hemolysis, while elevated conjugated bilirubin suggests liver or bile duct issues. Complete blood count, CBC, can identify anemia or infection. Coagulation tests, to assess the liver's ability to produce clotting factors, which may be impaired in liver disease. 3. Imaging. Ultrasound, to check for liver damage, gallstones, or bile duct obstructions. CT scan or MRI may be used to detect tumors or blockages. Endoscopic retrograde cholangiopancreatography, ERCP, a specialized imaging technique used to visualize the bile ducts and remove blockages. 4. Liver biopsy. In some cases, a liver biopsy may be performed to examine liver tissue and assess for conditions like cirrhosis or hepatitis. Treatment of jaundice. The treatment of jaundice depends on the underlying cause of the condition. Some general treatment options include managing hemolytic anemia. In cases where jaundice is caused by excessive red blood cell breakdown, treating the underlying condition, e.g., blood transfusions, medications, is necessary. Liver disease treatment. For hepatitis or cirrhosis, antiviral drugs, lifestyle changes, such as avoiding alcohol, and medications to manage complications, e.g., diuretics for fluid retention, may be prescribed. Bile duct obstruction. If jaundice is caused by a blockage, procedures to remove gallstones, drain the bile ducts, or treat tumors, e.g., surgery, stent placement, or chemotherapy, may be necessary. Phototherapy. In newborns and infants with jaundice, phototherapy, light treatment, can help break down bilirubin in the skin. Prevention of jaundice. While some forms of jaundice, such as those caused by genetic conditions or liver cirrhosis, may not be preventable, others can be managed or avoided by maintaining a healthy lifestyle and seeking timely medical care. Preventative measures include vaccination. Vaccines for hepatitis A and B can prevent viral infections that lead to liver damage and jaundice. Avoiding alcohol. Limiting alcohol intake reduces the risk of liver disease and cirrhosis. Regular health checkups. Regular monitoring for conditions such as diabetes and high cholesterol can help detect and prevent liver disease. Safe blood transfusions. Ensuring that blood transfusions are matched properly can prevent hemolytic reactions. Conclusion. Jaundice is a significant clinical symptom that indicates an underlying issue with bilirubin metabolism or excretion. It may be caused by various diseases affecting the liver, blood, or bile ducts. Early diagnosis and appropriate management are crucial to prevent complications, particularly in conditions like hepatitis, cirrhosis, or gallbladder disease. Treatment is tailored to the underlying cause, and in many cases, jaundice can be effectively treated with proper medical care.